Greetings. I am Dr. Joanna Piro-Teach, professor in the Department of Kinesiology and Recreation Administration, and I welcome all of you to KIN 3500. This is Emergency Care and Safety Techniques. This is a 2-credit-hour online course that will be offered as a mini-master during the spring or the fall semester. It will also be offered in the summer. This course is designed to prepare students to have knowledge and skills on how to respond to emergencies. So you could be certified in first aid, basic CPR, AED, and the CPR is for child, adult, and infant. The course prepares participants to recognize, evaluate, and respond to emergencies, sudden illnesses, injuries, and other accidents that requires immediate attention or immediate response in order to maintain life or to minimize the consequences of potential life-threatening emergencies. Learning opportunities will focus on, again, being prepared, how to prepare, what you need to do, the skills and the knowledge that you need, how to protect yourself, and then how to give CPR to adults, children, and infants. You will also learn how to use an AED, an automated external defibrillator. And all this there will be reading materials, there will be skills practice, as well as videos that you get an opportunity to watch and practice. The competencies as the standards have been divided into 3. So we have 3 learning outcomes. Learning outcome number 1 is that the students will demonstrate the role of a citizen responder. What is your role as a citizen responder? You're the first person in that chain of survival. What is it that you need to do? What are the skills that are necessary for you to have in order to save or to minimize the impact or the consequences of potential life-threatening emergencies? So that will focus on being prepared, citizen responder, things that to do in the event of an emergency, and how to prepare yourself, how to protect yourself, and how to prepare yourself. Learning outcome number 2 will focus on CPR, that is adult, child, and infant. When, how, and who to give CPR, and the do's and the don'ts of CPR. Learning outcome number 3 will focus on AED. Using an AED, when to use an AED, important things that you need to know about the AED. And just to remind you that an AED is the most critical equipment that you need to use in the event of an emergency. We are told, or research tells us, that every minute an AED is delayed, the person's chances of survival are reduced by 10%. So this is really critical that we learn and we know how to use the AED. The course has been structured into 8 different modules to help you plan your time or read through the modules, and you can actually go at your own pace. So module number 1 will focus on introduction. You'll take some time to read through the materials, get to know where the materials are, where everything is located on Blackboard. You'll also take time to introduce yourself to your classmate as well as your professor. And then you start learning on preparing to help. What does it mean? How do you prepare to help in the event of an emergency? What are some things that you need to know? What are some things that you need to have so that you are prepared to help in the event of an emergency? Module number 2 will focus on protecting yourself. As we prepare to give help, it's also important that you protect yourself from infections. So this will focus on protecting yourself, how to protect yourself, and the role of the medical emergency services, and what is your role in that system. EMS, what is it, and who is the EMS? Who is this EMS? What is their role, and what is your connection with the EMS? Module number 3 will focus on checking the victims and briefing emergencies. So how do you check a victim? When you walk into a scene of an emergency, you have a victim who appears to have been hurt or to be in pain. How do you check that victim? And how do you start giving care for breathing related emergencies? So this is checking the victim from the time you walk into the scene and giving care for breathing related emergencies. Again, this is for the adult, child, and infant. Module number 4 will get into the cardiac emergencies, cardiac and unconscious choke. So this is where we get into the CPR. What are cardiac emergencies? What are the causes of those emergencies? What are the symptoms? What are the triggers? And then how do you give CPR? This is a module that it will take, this is the most important. Again, you'll take more time on this module because this is where all the skills are located. This is where you learn to give CPR for the adult, child, and infant. You'll also learn skills on how to care for unconscious, choking child, infant, and adult. Module number 5 will get into the first aid. We'll start with caring for bleeding, caring for shock, and all the soft tissues related injuries. So again, what are the symptoms? What are the do's? What are the don'ts? That is caring for bleeding, shock, and soft tissues injuries. Module number 6 will focus on musculoskeletal injuries and injuries to the extremities. Module number 7, we get into the sudden illnesses. What are those sudden illnesses? Stroke, shock, poisoning. What are those sudden illnesses? So fainting, so anything that happens very suddenly. Poisoning, bites and stings, and heat and cold related emergencies. And then finally, module number 8, this is a culmination of your exams for those of you, especially those who really want to get the certification. So we'll do the cumulative exams on the CPR, AED, first aid, and then a final project for those who, I really recommend that all of you get the CPR certification. Like I said from the beginning, most of you, those who are going to do your internship, you will need the certification. Most of you will need it at your jobs. You just have no idea when you're going to need it. So I encourage all of you to save $30. It's only $30 to get your certification for 2 years. So make every effort to get there. Again, everything will be posted on Blackboard. My information is there, my email. Feel free to email me anytime. Feel free to schedule a virtual meeting via Zoom, via WebEx. We can schedule a conference call, whatever you need. I just want to make sure that you really learn the skills because these are skills that we all can use. We have no idea when to expect an emergency. So I hope you will take this course very seriously. Again, thank you so much for selecting to take this very important course. And I look forward to interacting with you virtually and even meeting with you. I would love to meet you if you want to come over anytime, do the skills, whatever. I'm just here for you. So feel free, stay in contact. Thank you so much again. This is your professor, Geronimo Ortiz, and you have a wonderful, wonderful, wonderful day. Thank you.